How do you know if your water's actually broken or if you just peed? I'm Abby, a certified lactation educator and a labor and delivery nurse. I normally talk about all things breastfeeding on my page, but right now I'm doing a labor and delivery series. So if you're interested in that, make sure you click the follow button. So in your belly, your baby is in what's called an amniotic sac. It's just the sac that baby's floating around in that's just full of amniotic fluid. When your water breaks, that means there's been some sort of puncture in that amniotic sac, and the amniotic fluid from that sac is what's coming out. Now it can come out very quickly and come out in a big gush, or it can come out in a small trickle. And a common question I get on labor and delivery is, does that mean my baby has no amniotic fluid left, or is it completely dry in there? How can they survive? So the answer is that even if you have a big gush, there is a lot of amniotic fluid in there. So your baby always has some amniotic fluid surrounding them. Plus, your baby's continuously making it. It's their pee. So usually when your water breaks, what comes out is just what was in front of baby's head up against your cervix. And so your baby's still swimming around in all sorts of amniotic fluid. And maybe when baby moves or you move, then you might see a little more come out. And that's just because there's more fluid escaping around baby's head. So rest assured, there's amniotic fluid in there still. There's just less. Something else that's also important to note with water breaking is the color of the amniotic fluid that comes out. So we want it to be a clear color, maybe a little bit pinkish with some blood, but nothing bright red. And we also really don't want any colors like brown or green. Brown and green might mean the baby had a bowel movement in your belly, and that usually means the baby's a little bit distressed. So clear is good. So when someone calls into labor and delivery and tells us that they think they broke their water, this is what we tell them to do. Clean up down there, make sure it's nice and dry, then put on a nice dry pad and see if the leaking continues. If you peed yourself or if it's something else, then it's not going to keep leaking. But if it's your water that's broken, then it is going to keep leaking, because once you break your water, you're going to leak till you deliver. If you think your water's broken or you know your water's broken, the doctors want you to go to the hospital immediately, because once your water breaks, you and baby are more at risk for infection. And because of that, your labor kind of gets put on a time clock. So they want you to deliver within a certain amount of hours after your water breaks, because again, the longer you sit with your water broken, the more chance you and baby have of developing an infection. Either way, if you're in doubt, call your doctor and head to the hospital.